Hi, my name is Raquetta Nerone, and I am the licensed marriage and family therapist of chronic illness therapy. This particular topic is a heavy one, grief. It's a big one as well. A lot of my clients don't necessarily realize that they are experiencing grief after a diagnosis, after they receive a diagnosis of a chronic and or terminal illness. Not only are the persons diagnosed with illness often grieving, but the people in their, systems are also often grieving. And what is exactly we're grieving? Because, in this scenario, no one has necessarily passed on at this point. Well, we're still grieving a lot. Um, as far as the person diagnosed with illness goes, they're often grieving the loss of abilities, right? Either physical abilities or mental abilities, emotional capabilities, all kinds of things like that, right? Um, those all change when we are given a chronic illness or terminal illness diagnosis, right? Sometimes they change physically and sometimes they change just based on us having emotional reactions to those kinds of things. We're also often grieving the loss of the life we spent our lives um, to this point working towards and planning for. Um, that whole idea of what we thought our lives would look like at a certain point in the future is now looking very, very different, often very, very different than what we had originally thought it might look like. Um, a lot of persons diagnosed with chronic and or terminal illness are often grieving the loss of their career identities, loss of personal identities, right? We will identify ourselves often by the roles that we carry, right? Spouse, partner, parent, caretaker, provider, protector, fixer. All of these things can very quickly start to look more like or feel more like, patient or cared for or provided for, right? And often we can kind of like feel a little bit like infantilized as well, right? By the people around us. And that can be pretty uncomfortable. It can be extremely emotional. People who are experiencing these things can often feel extremely emotionally unstable. We call it kind of crazy making situations, right? And it's often even harder because we don't realize that what we're actually experiencing in a lot of these situations is grief. As far as the care partner role, and in therapy and what they're often experiencing in terms of grief, we're also grieving the loss of the life we spent our lives planning for and working toward. Um, even as kids, yes, we see ourselves taking care of our parents often, right? We see ourselves taking care of our parents at a certain time, but it usually doesn't look like in our minds what it ends up looking like in reality. Um, we're also grieving the loss of our previously identified familial roles, right? So often, cared for person, um, and provided for person and spouse, right? All of these things, you know, whenever there's this big change in the system, all of these other things often, you know, will find themselves changing. Um, we're also grieving our loss of career identity, right? Because when we're care partnering, we are not always as present in our careers, and we can't always be as present in our careers as we were previously. And as the illnesses progress, right, we see those roles shifting even more, um, which is a whole nother round of grief. Every change in ability, every progression, every stage of progression of disease opens up a new round of grief, right? A new idea, a new perspective on grief and a new thing that we're losing and needing to adjust to. Um, and then often with care partners, right, we find our roles changing and shifting to more of a parental feeling role, especially as the disease continues to progress. And that can feel pretty uncomfortable. And it's not really the role that we went into this, with. And so in therapy, we often talk about, how do we maintain being a spouse? How do we maintain being a child? How do we maintain all of these like different things that we ways that we defined ourselves prior to the diagnosis? How do we kind of find these things again in this new circumstance? So that's some of the grief related things that I often see people experiencing within the scope of my practice. And I hope that information was helpful for you. Thanks for watching.